Well, we've seen the images coming out of Gaza of starving children, and of course, they are so difficult for really anyone to see. And while it may seem like it's happening a world away, there are families and groups impacted right here in our area, and many organizations are working to get aid to starving Palestinians in Gaza. And one of those organizations is MedGlobal, a Chicago area medical nonprofit. And joining us is the president of MedGlobal, Dr. Zaher Sahloul. Doctor, thank you for joining us to talk about the situation on the ground there.
Good morning. Thank you for having me.
We actually talked to someone from your team, or one of our reporters did yesterday, and they talked about the amount of people malnourished having tripled in Gaza. We're hearing things are worse than they've ever been. Can you describe the latest situation?
I think we are reaching an inflection point in Gaza where the 22 months of war and the last blockade of more than 3 months and the trickling of aid that is allowing only an average of 29 trucks a day compared to 500 a day before the war and 500 before the ceasefire was broken, that we are seeing the impact of that on children. And we have acceleration of number of admissions to the hospital, which increased by 400% compared to the last month, of children below age of 5 who have severe acute malnutrition, and also the number of deaths related to the severe acute malnutrition. Only in the last week, we had 5 children between age of 3 months and 4.5 years who died in our clinic with severe acute malnutrition. And also we have seen increased death among other children, of course, with acute malnutrition. In this last month, we had 65 children who died with severe acute malnutrition compared to 75 in the whole year. So there is acceleration of morbidity and mortality, death related to this condition, which is acute emergency, because up to 50% of children with severe acute malnutrition or SAM die.
And it's so devastating when we're seeing here at home the photos of so many children there. And when you talk about children dying, when they're at this malnourished state, and correct me if I'm wrong, they need specialized medical care, not just food. And so what obstacles are you facing getting them that care with the logistics and the legality of being able to go in?
We have special clinics, we call them stabilization clinics, that our organization MedGlobal have established in Gaza year and a half ago, when there was some alarms about beginning of this crisis that we are seeing right now unfolding. And we provide what's called ready-to-use therapeutic food, which is peanut-based with vitamins and macronutrients that we provide to the children. Some of them, just normal feeding, some of them through an NG tube, some of them through IV tube. And of course, these children need to be treated in these specialized centers or in the hospital with severe acute malnutrition. And sometimes they have complications, even with the feeding. There's something called refeeding syndrome. But the main obstacle, of course, is the blockade that is not allowing us to bring more of these very simple and cheap and products that make the children survive. And that are easy to give, even in the context of Gaza, does not require preparation or refrigeration. But because of the blockade, we're not getting enough supplies in.
Yeah, I know that's what so many groups are facing right now. We have so much more that we could talk about. I know we'll be continuing the conversation as we continue through this situation. Dr. Zaher Sahloul, thank you for joining us, president of MedGlobal. We appreciate you being with us, and we'll be right back with your headlines.